Welcome. I am Dr. Sara Malik, a board-certified urologist. Before we start the video, I want to know, how old are you? And which country or city are you watching from? Please write it quickly in the comments. Your input helps me understand my audience. Today, we are going to discuss a crucial yet often overlooked topic in men's health, the biggest intimacy mistake men over 50 make. This isn't just about the bedroom. It impacts your overall health and relationships. Many men believe that issues with their sex life are just a normal part of aging. But the truth is, avoiding the problems or addressing them incorrectly is the biggest mistake. Scientifically, the mistake is ignoring the physical cause of changes in erection and attributing it solely to mental factors or age. Weak erections are often an early warning sign for cardiovascular or vascular health problems. In today's discussion, we will cover why this mistake is dangerous, what the physical causes are, and how to maintain a healthy, intimate life with expert advice. When we talk about erectile dysfunction, we often view it as a local problem. But the arteries inside your penis are much smaller than the ones in your heart. When blockages first start in these smaller arteries, the first warning bell rings, and that is a weak erection. These changes can be an early indicator of silent killers like diabetes or high blood pressure. Decreased testosterone lowers libido. On the other hand, smoking is the biggest enemy of your vascular health. Excess weight, poor diet, and lack of sleep also increase ED risk. Therefore, changing your lifestyle is the first step before seeking medication. Many men experience penile curvature or painful erections and assume it is just an injury. This could be Peyronie's disease, caused by the formation of scar tissue. If caught in the early stages, it can be treated with medication or injections. The first and most important tip is to talk openly with a urologist. We check your hormone levels, cardiovascular health. Treatment options are modern: oral medication, lifestyle changes, and even surgery in complex cases. Another big mistake men over 50 make is viewing penetration as the sole ultimate goal of intimacy. This pressure is called performance anxiety. It creates a cycle. You get anxious, the erection weakens, anxiety increases. Broaden intimacy, foreplay, touch, kissing, emotional connection. These enhance relationship satisfaction. Men often fail to discuss their issues with their partners, which leads to misunderstanding. Open, empathetic communication is crucial. Tell your partner the issue is not a lack of desire for them, but a physical challenge. Give more time for foreplay. Don't rush the process. We urologists often say, the health of your penis is a reflection of the health of your heart. Here are expert tips to boost your capabilities: regular cardiovascular exercise, healthy diet, adequate sleep, and using lubricants as needed. Being proactive and prioritizing your health is the key to maintaining a satisfying life after 50. In conclusion, the biggest intimacy mistake men over 50 make is ignoring physical changes and not seeking expert advice. If you see any changes in your erection, report it to your urologist quickly. This will protect not just your sex life, but your overall health. I am Dr. Sara Malik, and I wish you a healthy, intimate life. Subscribe for more health tips.
For more accurate and helpful men's health advice, make sure to subscribe to the Dr. Sara Men's Health channel. Stay healthy, stay informed. I'll see you in the next video.